last row, could you give me a thumbs up if you can hear me? Thank you. Thank you. Well, good evening and welcome. Welcome to the 22nd Wellness Trails event that we have been holding since 2017. My name is Kumara Sidhartha. I'm a physician. I'm a medical director at Cape Cod Healthcare. And for those of you, by raise of hand, how many of you are here for Wellness Trails for the first time? Wow. Well, I'm glad you're here. Welcome. So I just want to give you a little bit of history. So we started this event in 2017, which we used to hold in a different manner before that, but we decided to do these under different topics and different themes, rather than how we used to have was like a one big day of a wellness fair where all the topics were discussed in different sections. So we kind of moved away from that model, and we wanted to test it out. And here we are, 22nd. Going strong. So clearly, you know, we get the message from you that this model is preferable. It works for you. I think folks want to have a focused discussion on a particular theme. And along the way, what we also did was we every event, after the event is over, we send out a survey to get your feedback on how the event went. What could we change to make it better? And what type of topics or themes would you like to hear more? So based on your feedback, we have chosen topics along the way based on that input. So, you know, using this concept of co-designing, so you are designing the whole theme with us. So it was a whole co-design concept of listening to you, listening to what matters to you, and then picking up topics and themes based on that. And that has been proven to be a win-win, because it is a good guidance for us, and you get what you want. So the format has always been that we involve physicians from the Cape Cod Healthcare and experts from the community who are physicians, other healthcare professionals, other wellness professionals in the community to kind of put together a program that is educational, that leaves you empowered to take care of yourself using lifestyle measures as you learn from here. Some of the topics we have covered in the past, one of our most popular ones is transitioning toward a plant-based diet, which we usually do it in January. So keep an eye out for that email coming to you. And we have discussed heart health, intestinal health, joint and back issues. We have covered dementia, women's and men's health. We have covered behavioral health, anxiety, depression, and sleep issues, management of pain. And also, we have tested out a pediatric section. We had a pediatric wellness trail last spring as well. We didn't want to leave the little ones out there. So I think it's been a very learning experience for us to kind of listen to you and design this. So again, after this event, you will get an email with a survey link to give us feedback on this. Some housekeeping notes. You have the snacks and the tea and the soup at the back. Did you all try the soup? Can I hear maybe a clap of hands? Yeah. So we'll have the next speaker, Diana, who is a registered dietitian, who's going to talk more about it, and that recipe came from Diana. So thank you, Diana. And the restrooms are located off the lobby on that side. And I want to thank the team here at the Resort Center, who are helping to set up the food. Reese and his buddy there helping us with the AV system every event. Thank you. And Pete and Chris for helping with the registration there. Thank you. Cape Cod Healthcare is invested in this community to make sure that we are covering the wellness piece as well to keep the population well. We're treating the sick patients, but we also want to make sure that we are covering the prevention angle, the wellness angle. So Cape Cod Healthcare is sponsoring this event, sponsoring the venue to make sure that we are able to hold these programs here with the setup that we have. So I want to thank Cape Cod Healthcare, and I want to thank Julie Badeau, who is an extraordinary organizer who makes this happen magically every time. There is a lot goes on behind the scenes to set this up, so thank you, Julie. And I think that's pretty much it. Yeah, okay. So today's theme is going to be covering autoimmune diseases and inflammation, specifically focused on these autoimmune diseases, but also I will touch upon some of the bowel diseases that have inflammation. They group together as inflammatory bowel diseases. They have specific names for it. Ulcerative colitis, Crohn's disease. I'm going to touch on all of that. But one of the things you would notice is that there is a common theme, there is a common thread that connects many of these diseases. So, in a way, the solutions are common and simple. It is actually mine, sorry. Can you hold on to this? Can you just hold on to this? Thank you. Sorry about that. Let's get started. So I wanted to use the word putting out the fire because when we talk about inflammation, that is symbolic of heat, inflammation, fire. So just a little bit on what is inflammation. The word itself, the origin of the word comes from Latin, inflammatio, and it's basically has a few main components to it. Heat, redness, swelling, pain, and loss of function. So simply put, it can happen anywhere in the body. If somebody bumps into the table and you have a little bump in your arm or in your leg, and there is a little bit of redness, there is a little bit of swelling, that is inflammation. And where there the body had an injury, physical injury, so there is always an insult to the body, and then body reacts to it. So there is an insult, and then there is a reaction, and that's what brings together this inflammation reaction. You could also think about somebody who has bronchitis. So where it could be a viral infection causing a bronchitis. There also, it's inflammation that's happening in the bronchus, in the bronchial tubes in the lungs. And there also there is an insult, but in that case, it's a virus. It's not a physical injury like bumping into a chair or a table, right? Again, so there is an insult and there's a reaction. Somebody who's an athlete, growing up having a lot of injuries, sports injuries in the knee, they get early arthritis in the knee, and there, again, there is an insult, physical injuries, sports injuries, there is a reaction, arthritis. Similarly, there is insult that happens to the body every day if we are not careful with our breakfast, lunch, and dinner, and snacks. And that leads to a low-grade inflammation, a reaction by the body on a regular basis, which is technically called as chronic inflammation. Chronic meaning long-term. Inflammation, we talked about it. So basically, every day what we choose to eat can add to inflammation or can actually reduce inflammation depending upon what we're choosing. So inflammation can be short-term, which is acute. It could be injuries, infection, things like that I talked about. Or it can be chronic, long-term, where you would see diet as a predominant factor, stress, mental stress, physical stress, radiation exposures, those kind of things can also cause long-term inflammation. Is that any questions on that so far? Okay. So let's touch on autoimmune disease. So one of the things we want to talk about autoimmune diseases is a concept called friendly fire. So in all of the autoimmune diseases, what's happening is that our body's immunity is attacking our own tissues. So it's basically a friendly fire, a crossfire situation where body is not recognizing our own tissues as our own, and it's seeing the tissues as an invading foreign tissue that doesn't belong to our body, and it's attacking it. So it's basically a misidentity issue. It's like, it doesn't see the body's own tissue as our own, and it starts to attack it. So I have a couple of examples I'm going to show you to explain it. There is this concept called molecular mimicry, which is tied with this friendly fire. So what is molecular mimicry is basically a molecule that our body gets exposed to. It could be a virus, it could be a type of food that our immunity sees it, recognizes it. And then it gets triggered to attack it. And then, so the simplest way I explain this is, do you know in the law and order world, in the world of cops and law and order, when there is a suspect, they have artists who actually do the face of the suspect and circulate it, right? So that's what happens in the immunity. So the immunity, anytime a virus, we get exposed to a virus, that face drawing of the virus, I'm just using face drawing, there's no face for the virus, but the face drawing of the virus is done and it's circulated to our immune system. So it goes out to all the police force that we have in our body to say, okay, if you see this person, attack. Got it? So it could be a virus. It could be a protein that we eat. For example, milk protein for type 1 diabetes. I'm going to talk more about it down the line in the next slides. But the casein, which is the milk protein, that could be one of that. So when the body sees that as it's foreign, right? It's an animal protein. It doesn't recognize it. It mounts a response, especially in genetically susceptible kids. So now the body has recognized a phase to attack. And then imagine another part of our body has the same phase. So if your pancreas, which produces a particular type of cell in the pancreas, which produces insulin, right? They're called beta cells. The beta cells in the pancreas have a phase that exactly mimics the phase of cow's milk protein, for which our police force has been alerted to attack. So what happens for the baby is, when the baby for the first year gets exposed to cow's milk, has a gene for type 1 diabetes. So the baby has a gene for type 1 diabetes, plus gets exposed to cow's milk protein that combo is a bad combination for that kid. Has the gene for type 1 diabetes, exposure to cow's milk protein, triggers an alarm in the system, the phase is circulated into the entire system, and the pancreas has a tissue that has a similar phase. So the immune system starts attacking the beta cells of the pancreas, destroys the pancreas that can produce insulin, and the baby cannot produce any more insulin, leads to type 1 diabetes. That's one example of friendly fire, molecular mimicry, where it mimics, there is a mimicry, and it starts to lead to a destruction of a particular tissue. It could be a virus, so some of the, or a bacteria exposures. We're going to talk a little bit about that. So same way, a bacteria can mimic tissues that are in our joints. So some bacterial exposure, certain types of gingival infections, dental infections, certain types of UTI can create the same response. A face drawing is done, circulated to all the police force in our body, and guess what? The joint tissues has a similar phase, so the body attacks the joint, and that leads to rheumatoid arthritis. So the theme in all of these autoimmune diseases, the underlying mechanism is the same. There is an exposure to a foreign antigen or substance that is not human tissue, and then there is an immune response that is mounted against it, and then one of our own tissues looks exactly similar, so the immunity attacks it. Any questions so far on that? So to me, from where the way I look at it, from where my perception is on all of this, autoimmune disease is one disease, in my view, the way I look at it, right? From a scientific perspective, it's one disease that manifests in different organs depending upon which organ that patient gets attacked. It could be rheumatoid arthritis for a joint issue, type 1 diabetes, Hashimoto's thyroiditis. So it's the same problem, different organs, and it has different names. We have different names for different autoimmune diseases. And this is the one thing, if you forget everything I say today, except remember the soup, the taste of the soup when you leave. But if you forget everything I say today, one thing you want to remember today is that autoimmune diseases is a disease of the gut. All autoimmune diseases are a disease of the intestinal health. And why is that? So we're going to see a lot of that. So trying to figure this one out. Yeah. So every autoimmune disease is in some way connected to the health of the intestinal system, the integrity of the gut's lining barrier, and the maintenance of bacterial balance in the gut. So there are three parts to it. So basically, if we have a healthy gut, if the gut's architecture, so to speak, is intact, including the lining of the gut, without any changes to it, abnormal changes, and then in the lining, there is adequate supply of good bacteria that we should be having. If we have that, that is the best defense against any inflammation, any of the chronic inflammation, not only related to autoimmune diseases, but even other things we're going to touch on today, like the Crohn's and ulcerative colitis. So gut health is fundamental. So in other words, all roads in autoimmune diseases lead to one road, and that's our gut health. So that's one way to think about it. And we know that diet controls the intestinal health and the bacterial balance. So that's why, if you look at it, that kind of closes the circle on, autoimmune diseases, molecular mimicry, gut health, and why diet is important in all of this. And that's why we are going to talk about this. So There's a lot going on here. But basically, I'm just going to translate this. There's a lot, there is some technical lingo going on here. So depending upon the food choices and the dietary factors, they can have an impact on the human cells, and they can have an impact on the bacteria, right? Because there are two different things going on. We have our own cells, and then we have the cells or the genes of the bacteria. And a lot of studies are now showing that if you take the gene count, like how many genes our body has, right? Trillions and trillions of genes, our tissue. How many genes do the bacteria have that is in the gut? Then the bacterial genes, that is like 100 times more than a human body has. So there is enormous amount of genetic diversity in the gut bacteria. And I used to have a professor who taught me a type of medicine in Europe, the European biological medicine, and he will joke about it. He will always say, we humans think that we are the host and the bacteria in the gut are our guests. But when you really look at the number of genes, he will say that we are the guest and they are the host. So, and so he'll say, we need to be nice to each other. So in a way, like eat better and all that. But so it's about how do you treat our guests and all of that. So yeah, so this is exposure. What does the diet factor do to our cells? And what does the diet factor do to the bacteria? It can do, based on what kind of diet we choose, it can do the normal digestion and breakdown of food into different nutrients, and produce energy and supply the nutrients. That's normal. Or it can also provoke changes and damage to the tissues and cause inflammation and create inflammatory molecules. And we can also say that similarly, the dietary factors can impact the health of the bacteria in a good way, or it can create an imbalance. In other words, the good bacteria is not able to survive enough so that there is a predominance of bad bacteria. There's always a balance in the bacteria in the gut. So we want to make sure that the number of good bacteria is more than the number of bad bacteria. So in other words, if the balance gets tipped off in a way that there is more of the bad bacteria, then a lot of these issues, inflammation, becomes a problem. So we'll touch on a few of the diseases just to kind of give you an idea. I won't be touching on every single autoimmune diseases, but as I already told you, there is a lot of common themes. So rheumatoid it's a very disabling disease. It affects joints. A lot of the patients have their hand joints involved. Feet can be involved. Other joints can be involved as well. It starts at a younger age and affects women more than men. So let me ask you this one. So how many of you have seen somebody in their 60s or 70s diagnosed with MS? 60s or 70s? That's kind of rare, very rare, if at all. So they may have other coexisting things. The reason why, it's kind of a trick question. The reason why I asked is that it is usually diagnosed when they're 30s, right? You will always hear, oh, that person was diagnosed with MS and she was just 30. You heard that? That is what consistently you will hear for every autoimmune diseases. You won't see a type 1 diabetic, at 70, right? It's a juvenile. MS, 30s. RA, 30s. Every Hashimoto's thyroiditis, 30s, 40s. Why is that? And the reason is, that's when our immunity is at its peak. So when we are growing as a kid, our immunity is immature, right? And the immunity gets to be more mature, more robust as we hit the 20s. As we get into the 30s, the immunity is at its peak. It's at its best. It's ready to attack anything that comes in that it doesn't like, right? And then after we hit 40, it plateaus. The immunity actually plateaus after that. And then after 50, 60, if at all there is actually a little bit of drop in the power of the immunity, it's not going up. So that's why autoimmune diseases, where our own immunity attacks our own tissues due to a misidentity, happens when the immunity at its peak, which is the 30s and 40s. So that's why you would see it more often. Virtually, you would see it mostly in the young age. And then we'll talk a little bit about why some of these diseases are more common in women. So for rheumatoid arthritis, there is a lot of new science that has come out to say how exposure to a bacteria, which is, remember I talked about the face drawing? So the bacterial exposure, immunity starts to draw the face of the bacteria, sends it out to everybody in the body, all the police force, and they start looking, where can we see this suspect? And the suspect happens to be in the joint, and they go and attack. So the bacteria can come from, for men, it can come from gingival infection in the mouth, like dental. And for women, it can come from their UTI, urinary tract infection, with either Proteus or E. coli. And these two bacteria are actually not even in the urinary tract. It actually comes from the gut. So when the gut bacteria, remember I talked about having more of the good bacteria keeps the bad bacteria suppressed, which is what we want. When the balance is tipped in a way that the bad bacteria is dominating in the gut, that leads to a situation where these bugs can travel to the urinary tract. So you're going to see a little video about it. It explains it, and it hones in on why it is important to have a good balance of the bacteria through a good diet, and how that can actually prevent or mitigate the risk of rheumatoid arthritis. This is another paper that was published in 2018. Just so you know, in your printouts, when we printed it, you will see that you may see a highlighted portion, an yellow highlighted portion that is there, like a line. It's actually, it printed in a wrong way. It's supposed to be a highlight where you can still see through the words, like I highlighted the name of the medical journal and the year it was published. It didn't come through well, so we will make sure that we will send a copy of these slides again to you by email so that you're not missing out on that information. So a lot of data on how what we eat has a key role in rheumatoid arthritis. The next one has the video. It's a kind of a 5-minute video. I'm going to let you watch that.
Rheumatoid arthritis is a chronic systemic autoimmune disease affecting millions, characterized by persistent pain and stiffness and progressive joint destruction, particularly in the hands and feet, leading to crippling deformities. What can we do to prevent it and to treat it? In a famous 13-month-long randomized controlled trial of plant-based diets for rheumatoid arthritis, patients were put on a vegan diet for 3.5 months and then switched to an egg-free lacto-vegetarian diet for the remainder of the study. Compared to the control group that didn't change their diet at all, the plant-based group had a significant improvement in morning stiffness within the first month, cutting the number of hours they suffered from joint stiffness in half. Pain dropped from 5 out of 10 down to less than 3 out of 10. A drop in disability. They reported subjectively feeling better, significant improvements in their grip strength in their hands, fewer tender joints, less tenderness per joint, less swelling, with the added benefit of losing about 13 pounds and keeping most of that weight off throughout the year. They also had a drop in inflammatory markers in their blood, SED rate, C-reactive protein, white count. The question is why? What does diet have to do with inflammatory joint disease? Well, rheumatoid arthritis is an autoimmune disease in which your body attacks the lining of your own joints. Why would it do that? Well, there's a different autoimmune disease called rheumatic fever, in which your body attacks your own heart. Again, why would it do that? Well, it appears to be a matter of friendly fire. Rheumatic fever is caused by strep throat, which is caused by a bacteria that has a protein that looks an awful lot like a protein in our heart. So when our immune system attacks the strep bacteria, it also attacks our heart valves, triggering an autoimmune attack by molecular mimicry. The protein on the strep bacteria is mimicking a protein in our heart, so our body gets confused and attacks both. That's why it's critical to treat strep throat early to prevent our heart from getting caught in the crossfire. So researchers thought maybe rheumatoid arthritis might be triggered by an infection as well. A clue to where to start looking was the fact that women seem to get rheumatoid arthritis 3 times more frequently than men. What type of infection do women get more than men? Urinary tract infection. So researchers started testing the urine of rheumatoid arthritis sufferers, and lo and behold, found this bacteria called Proteus mirabilis. Not enough to cause symptoms of a UTI, but enough to trigger an immune response. And indeed, there's a molecule in that bacteria that looks an awful lot like one of our own molecules in our joints. So anti-Proteus antibodies against the bacteria may inadvertently damage our own joint tissues, leading eventually to the joint destruction. Therefore, therapeutic interventions aimed at the removal of this bacteria from the bodies of patients with consequent reduction of antibodies against the organism should lead to a decrease in inflammation. Well, as we saw before, urinary tract infections originate from the fecal flora. The bugs crawl up from the rectum into the bladder. And so how might one change the bugs in one's colon? By changing our diet. Some of the first studies over 20 years ago on trying to fundamentally shift people's gut flora were done using raw vegan diets, figuring that's about as fundamental a shift from the standard Western diet as one can get. And indeed, within days, one could significantly shift someone's gut flora. And you put rheumatoid arthritis sufferers on that kind of diet, and they experience relief. And the greater improvements were linked to greater changes in their gut flora. But the diet was considered so intolerable that half the patients couldn't take it and dropped out, perhaps because they were trying to feed people things like buckwheat beetroot cutlets buttered with a spread made out of almonds and fermented coconut juice. Excuse me, not coconut, that might have been good. Cucumber juice. Thankfully, regular vegetarian and vegan diets work too, changing the intestinal flora and improving rheumatoid arthritis. But we didn't specifically have confirmation that plant-based diets brought down anti-Proteus antibodies until now. Those that responded to the plant-based diet showed a significant drop in anti-Proteus mirabilis antibodies compared to the control group. Maybe just dropped immune responses across the board? No, antibody levels against other bugs remained the same. So the assumption is that the veg diet reduced urinary or gut levels of the bug. A shift from an omnivorous to a vegetarian diet has profound influence on the composition of our urine. For example, higher levels of lignans in the urine of those eating vegetarian. Up until now, it's just thought that they protected people eating more plant-based from getting cancer. But now we know lignans can also have antimicrobial properties as well, so maybe helping to clear Proteus from our system. Either way, this suggests a new type of therapy for the management of rheumatoid arthritis. This new treatment includes anti-Proteus measures such as dietary manipulations in the forms of vegetarian diets.
Okay, so I think that I set the stage to kind of understand this. There's a lot of concepts discussed in this. So if we think about diets, if we think about dietary fiber, what foods in our diet has dietary fiber? Those because those fiber is what enriches the good bacteria to survive in the gut. In other words, the fiber, the undigested fiber that we don't use. When we eat food, we have fiber, we have other nutrients like protein and fats and starch and glucose that all comes to us. Our body takes up and absorbs the nutrients. It absorbs the calories, but it doesn't do anything with the fiber. It doesn't absorb the fiber, right? The fiber is excreted. But who's making use of the fiber is the good bacteria. So the good bacteria thrives well in the gut as long as our diet composition or meal choices has enough dietary fiber, which is basically in a ton of fruits and vegetables and legumes and whole grains and things like that. So I think that's one of the things to think about is how can diet improve the intestinal health, and how can that minimize exposure to the bad bacteria, and which can help us to avoid immune response that starts to attack our own tissues in these kind of situations. Any questions? Yeah. Good question. So the data, there is a lot of talk and there is a lot of products they sell about probiotics. Probiotics have not shown to help with long-term wellness and improvement in these kind of situations. The studies on probiotics are minimal. So the best way to improve the gut bacterial balance is actually to eat in a way that they thrive well. It's like, the way I see it is, it's like sowing seeds in the garden. If we sow the seeds, then we need to create the right environment. We need to put the nutrients. We need to add water, sunlight, good soil for the seed to grow, right? The same way, the bacteria in the gut are like the seeds. So we need to supply the nutrient, which is the undigested fiber, the dietary fiber, create the right environment, and it will start to thrive well. So keep on adding seeds is not a good idea. It's just all you need is a little bit, which happens with the way we eat in a natural way, dietary fiber, and so there is no point in taking pills or supplements, and it doesn't help. There's no data to show that. So I'm going to move on to lupus. Another autoimmune disease. It can affect different folks have different areas that are affected: skin, joints, kidneys, brain, lungs, or blood vessels. So lupus also increases the risk for heart attack and stroke, and invariably they have high cholesterol related to this. Again, you would see a lot of data that has been published looking at the importance of diet and lupus. More on this, looking at the importance of antioxidants, that is the colorful aspect of fruits and vegetables, antioxidants, and how they're important in lupus that affects the brain. So based on the review, the idea is to, every dietary recommendation needs to be individualized because, Julie's dietary need will be different from Diana's. Every one of your dietary need is unique and different because you are unique. So there are broad themes that we may discuss here, but every one of you needs to have an individually tailored dietary recommendation. Calorie restrictions, so not eating excess calories always helps. We talked about dietary fiber. Whole grains, again, that brings the fiber. Refined processed grains doesn't have any fiber. Omega-3 fats. So omega-3 fatty acids are anti-inflammatory, and I'll have Diana talk a little bit more about that in Diana's presentation. And and avoiding consuming excess protein. So too much protein, no matter where the protein is coming from, whether it is animal-based, plant-based, doesn't matter. Too much protein is just too much burden for the body, period. It's just a lot of work for the kidneys, a lot of work for the liver when we eat too much protein, no matter where it's coming from. Excess protein is bad, right? Excess protein is especially bad if it comes from animal-based foods because it provokes inflammation, as you would see in the other slides I'm going to talk about. And in somebody who has lupus, who commonly have other problems like the kidney issues, it's just an added problem for the kidneys to consume a lot of protein. Some studies are coming out now showing turmeric, which is that yellow spice, to be helpful in lupus-related kidney diseases. Turmeric is an anti-inflammatory, so it helps in many ways. So that's something to think about. Other things like flax seeds, which are high in omega-3, pumpkins and carrots, high in vitamin A, antioxidant, nuts, which are high in fiber and vitamin E, another antioxidant, oranges and apples, again, tons of antioxidants and phytochemicals. So all of them are good additions. Moving on to multiple sclerosis, I would say that the studies that have been done on multiple sclerosis and diet, we need more evidence in that. We don't have a robust scientific evidence to say categorically that this kind of a diet regimen works. But we do know that in general, consuming less fatty foods helps. Increasing fruits and vegetables helps. And decreasing sugar, decreasing saturated fat helps. That we know. And again, the evidence is indicating that diet, if it improves the gut bacterial balance, that it could help with multiple sclerosis. Excuse me. And this is from the National Multiple Sclerosis Society. Type 1 diabetes, I think during the introduction I already talked a lot about it, so we can fly through this slide. So the baby has to have the gene to develop type 1 diabetes. That's a must. That's a condition. The baby is born with a gene to develop type 1 diabetes. The gene alone is not going to give the disease to the child. So in other words, a baby that is born with type 1 diabetes gene but never got exposed to cow's milk or dairy will not get juvenile diabetes. Does that make sense? So in those days, and this is, when I talk about this, I always say, if you're a mom here, don't go feel guilty about things, and it's a common thing for moms to feel that way. I always say that knowledge is something that once we learn things, that's different on how we approach it. But we do need to realize that there are two things need to be there. The genes need to be there, and exposure to cow's milk protein needs to be there. And that's why, after learning all of this in the 80s and 90s, the recommendations for feeding the infant with cow's milk has changed over the years, right? Pediatricians used to recommend cow's milk, but now the first 1.5 years, the recommendation is strongly against giving cow's milk protein to the kid. And that's all based on this knowledge that we learned over the years. Wait a minute, sorry. So the genes need to be there. Infant diet needs to get, the baby needs to get exposed to cow's milk protein, which starts to mess up with the bacterial balance. There are some theories about exposure to food additives and coloring agents in the diet. Not a strong data yet, but there are some emerging data on that. And then there is also some data questioning whether viral infections in the kid could be contributing. I already talked about it, so this is just an explanation of how the casein milk protein, which mimics, it's again a molecular mimicry. It looks exactly like the pancreatic cells that produce insulin. So you need to have that trigger, dietary trigger, that leads to change in the gut lining. And then the baby has to have a genetic factor. So these two put together leads to type 1 diabetes. That's just a study that shows, it's a correlation study. So it shows that in countries where milk consumption is high, cow's milk consumption is high, the occurrence of type 1 diabetes is high. In countries that don't consume as much milk, type 1 diabetes is less. So it's a correlation. It's not a causation link. It's more of a correlation study. It's not a slam dunk theory, but it helps us to hone in on more research. Thyroid disease. Autoimmune thyroid disease constitutes 30% of all the autoimmune diseases. Iodine and selenium from the diet is important to maintain normal thyroid function. Again, same theme, gut bacterial balance plays a fundamental role again in making sure people don't get Hashimoto's thyroiditis. It's an inflammation in the thyroid. A couple of studies that again shows how the intestinal bacterial balance is important to prevent Hashimoto's gut bacteria. So some of the things to think about in Hashimoto's is there are some foods that can create more imbalance in the thyroid hormone levels. They are called goitrogenic foods. It happens to be raw cruciferous vegetables. So raw broccoli, raw kale, if consumed too much, can actually change your thyroid numbers. So the recommendation is always, yes, they're all healthy foods, right? Kale, broccoli, cauliflower, healthy foods. Just make sure that you cook them. If you cook them, it doesn't have the negative impacts of a thyroid hormone level. Reducing exposure to chemical iodine displacers like chlorine, getting enough iodine. One of the best sources for iodine, if you're reducing salt, iodized salt is one, but too much salt is a problem. So seaweed like kelp and things like that are an excellent source of iodine. And selenium, Brazil nuts is a very good source for selenium. You don't want to eat too much of Brazil nuts because it can actually be toxic level if you eat too much. So I always recommend 3 to 4 a day. Stress management helps to balance the thyroid. And anything that will make the gut more irritated. If somebody is sensitive to gluten or dairy, avoiding that can help with that. And then regular physical activity actually helps to maintain a good thyroid number as well. All right, so we're moving on to bowel disease. So these are long-term inflammation that can happen in the intestine. So the difference between Crohn's and ulcerative colitis is they are pretty much similar in terms of the mechanism of the disease. In ulcerative colitis, the inflammation is only in the colon. It's only in the colon. That's it. In Crohn's, it can affect anywhere in the intestine, anywhere, including up to the mouth, food pipe, anywhere in the small intestine, large intestine. So that's Crohn's. Surprise, gut bacteria is involved in this. So again, we know that change or imbalance in the gut bacteria may play a pivotal role in the creation of inflammatory bowel diseases. We have a couple of videos, and then we should be able to close.
We know plant-based diets decrease markers of inflammation, but to see if plant-based diets decrease inflammation in a clinically relevant way, you've got to put it to the test. The gold standard for evidence in nutritional science is an interventional trial. You split people up into two groups, put half on one diet, half on the other, see what happens. Inflammatory bowel diseases, such as Crohn's disease, is an autoimmune condition where your immune system attacks your own intestines. There's no cure. All you can do is try to keep it in remission as long as possible between attacks. Sufferers are often put on anti-inflammatory and immunosuppressive drugs and may find themselves in and out of the hospital getting segments of their intestines surgically removed. Since it's the intestine itself that's inflamed, that would seem to be a good condition to test out the anti-inflammatory power of plant-based diets. We've known that meat, cheese, fish, animal protein in general has been found to increase risk of developing inflammatory bowel disease. But what about plants to not just prevent, but treat it? Japanese researchers took a group of Crohn's patients in remission, either because they just came out of surgery or they were able to beat it back with steroids, and for 2 years asked half of them to eat a semi-vegetarian diet, meaning in this case vegetarian, except for half a serving of fish a week and a half a serving of other meat once every 2 weeks. But otherwise, they were supposed to eat vegetarian, less than 1 serving of meat per week. Now, this wasn't a prison study or anything. They were free-living adults. So the results are not necessarily what happens when Crohn's sufferers actually go on a plant-based diet, but what happens when people are just told to eat a plant-based diet, and how much they comply is up to them, which makes the results even more astounding. Check this out. The dashed line is the standard diet group. The solid line is the semi-veg. 200 days into the study, all the patients told to eat more of a plant-based diet are still in remission, but about 20% of the group not told to eat anything different relapsed. After a year, 100% of the semi-veg group still symptom-free.
Okay, I've seen that video a million times, so I can tell you what happens. So basically, 200 days, 80 to 85% of the patients who went on a semi-plant-based diet remain symptom-free. So in remission, we call it. Very remarkable, powerful results, because these patients, I don't know if you have anybody Crohn's or you have family member, it is a very difficult disease. Now we have very powerful medications, like new latest medications to hit hard, but it's a very difficult disease. And to think and to see a data like this that can create such a profound result just with what they're eating, not having to pay hundreds of dollars at the pharmacy for copay for these expensive medications, just going to a grocery store, changing a recipe, and just doing differently, that's just remarkable. And I felt compelled to share that. I mean, withholding that from you is probably a crime, so I had to share that. And we'll go one more video, and then we'll close. Julie, I know you're keeping an eye on my time.
Crohn's disease is an autoimmune disorder that affects more than 1 million Americans. Inflammatory bowel disease, in which your body attacks your own intestines. There's currently no cure for Crohn's disease, and current research focuses on just controlling symptoms. There's no definitive medical or surgical therapy. In fact, the best we have is a more plant-based diet, which has afforded the best result in relapse prevention to date.
You got it.
They got the idea to try it because diets rich in animal protein and animal fat have been found to cause a decrease in beneficial bacteria in the intestine. And so they designed this semi-vegetarian diet to counter that, and 100% stayed in remission the first year and 92% the second year. These results are far better than those obtained by current drugs, including these new so-called biological agents that can cost $40,000 a year and cause side effects like progressive multifocal leukoencephalopathy, disabling and deadly brain disease. Whereas the diet doesn't cost $40K, and what the worst that can happen is maybe get green stuck in your teeth or something. And diet appears to work better. What about preventing Crohn's disease in the first place? Well, a systematic review of the scientific literature on dietary intake and risk of developing inflammatory bowel disease found that high intakes of fats and meat was associated with an increased risk of Crohn's disease, as well as ulcerative colitis, whereas high fiber and fruit intakes were associated with decreased risk of Crohn's. This was supported more recently by the Harvard Nurses Health Study. 3 million person-years of data revealed that long-term intake of dietary fiber, particularly from fruit, was associated with lower risk of Crohn's disease. Women who fell into the highest long-term fiber consumption group had a 40% reduced risk, leading the accompanying editorial to conclude that advocating for a high-fiber diet may ultimately reduce the incidence of Crohn's disease. The irony is that the highest fiber group wasn't even reaching the official recommended daily minimum of fiber intake, but even just being less fiber deficient has a wide range of benefits, including, evidently, a significant...
Um, I can explain this video too. So basically, that fiber amount, that 24 grams, is actually, that's in the study, that the group that was consuming the highest dietary fiber was eating 24 grams per day, which is not even meeting that the recommendation. National recommendation is around 30 grams. So bottom line, high fiber, good bacteria in the gut is happy because now we fed them, because what we don't digest, the undigested fiber, is what the good bacteria thrives on. So they're happy, better bacterial balance, less inflammation, gut lining is intact. So it's a better way to deal with that. So basically, I just want to wrap up just to remind you, autoimmune diseases are all related to friendly fire. There is molecular mimicry. Remember the face drawing in the police thing. Same problem, different organs, different names. All roads in autoimmune diseases lead to gut health. So I think you have this all in your handout. I'm not going to go over this, but basically recommendation, more fiber, more omega-3. These has no fiber and just more harm to the gut. So there are some things you want to limit and some things you want to avoid if you have these diseases. Mediterranean diet and a whole food plant-based diet are two ways to look at it, by how do we increase the plant foods, and that was that. I went overboard a little bit. So what I would do, I want to make sure that Diana